When we were young, many of us experienced excellent vision at all distances, near, intermediate, and distant. But as we age, usually around the age of 40, we lose the ability to see up close, a condition known as presbyopia. As we continue to age, most people will eventually develop a cataract, which causes our vision to blur and our color perception to diminish. Patients often complain about loss of functional vision. They may see glare and have a difficult time driving at night. If left untreated, cataracts could eventually continue to develop to the point of causing blindness. Before a cataract develops, the eye's natural lens located just behind the pupil is clear, allowing light rays to pass through it to focus clearly on the retina. But over time, the natural lens becomes cloudy, blocking light rays from reaching the retina. In order to see clearly again, the natural cloudy lens needs to be surgically removed, and in its place, an artificial intraocular lens, or IOL, will be implanted. There are many types of intraocular lenses that are available. Which IOL is best for you depends on the unique characteristics of your eye, as well as your lifestyle needs.
Please ask your doctor which IOL may be best for you.